Hello friends, welcome to Introduction to Safety, the first sub-module under Safety in the course Health, Safety, Environment Protection or HSE. HSE consists of 4 main modules that will cover the above-mentioned aspects in detail. Click here to view the learning outcomes for Introduction to Safety. Learning outcomes. After going through this module, you will be able to safety with a clear understanding of various terms and definitions used in this vast field. Terms and definitions include health, safety, environment protection, welfare, hazard, risk, risk assessment, accident, incident, near miss, frequency rate, severity rate, etc. Explain the legal, moral, social, and economic reasons for establishing and maintaining good standards of health and safety in the work environment, with particular reference to direct and indirect costs of accidents, insurance costs, legal liability costs, legal perspective of health and safety, expectations of society from organizations, and moral reasons for health and safety management. Millions of workers die, are injured, or fall ill every year as a result of workplace hazards. Improving occupational health and safety is in the best interests of all governments, employers, and workers. Therefore, measures to make improvements should be discussed and agreed at all levels. Occupational health and safety has quite a broad-ranging scope. It involves many fields with a lot of special areas with an overall aim to promote and maintain the well-being of employees, protect employees and others who may be affected by an organization's activities from the risk to their health and safety, provide suitable and sufficient welfare facilities, establish a management framework to manage and control workplace risks, minimize the consequences or impacts of failure, monitor safety performance with the aim of continual improvement, aligned with other aims and objectives of the business. You have been introduced to the aim and scope of occupational health and safety. Now, let's look at how and why health and safety performance varies. Occupational health and safety performance varies significantly between economic sectors within countries. Statistical data shows that agriculture, forestry, mining, and construction take the lead in the incidence of occupational deaths worldwide. The International Labour Organization's or ILO Safe Work Program has estimated, for example, that tropical logging accidents caused 300 deaths per 1 lakh workers. In other words, 3 out of every 1,000 workers engaged in tropical logging die annually or from a lifetime perspective. On an average, every 10th logger will die of a work-related accident. Similarly, certain occupations and sectors, such as meat packaging and mining, have high rates of work-related or occupational diseases, which could even be fatal. Generally, small workplaces have a worse safety record than large ones. It seems that the rate of fatal and serious injuries in small workplaces, defined as less than 50 employees, is twice that in large workplaces, defined as those with more than 200 employees. You have been introduced to variations in health and safety performance. Now, let's look at the barriers to good standards of health and safety. Complexity. Workplaces can be complicated, requiring coordination between many people performing different activities. Therefore, finding a solution to a specific health and safety problem or issue can be complex, needing extensive background knowledge and an awareness of the possible consequences of the various courses of action that are likely. Conflicting demands. Often, competing and conflicting demands are placed upon people and organizations. A common conflict of interest occurs when the organization needs to choose between the need to supply a product and/or service at an appropriate speed so as to make a profit, and the need to do so safely and without risk to people's health. Another conflict can be created by the need to comply with different types of standards at the same time. For example, having to comply with health and safety laws, environmental protection laws, etc. simultaneously. Behavioral issues. Good standards of health and safety often rely on the perfect behavior of individuals, and as we are all aware, people do not always behave in the ideal way. The solution to a health and safety problem usually requires a worker to undertake their task in a particular way. Example, a worker on a construction site should wear head protection or hard hat to protect themselves from falling objects. But people are not robots. They do not always behave as they are supposed to. Workers sometimes make mistakes or they do the wrong things, thinking that it is the correct way to do something. At other times, people even do wrong things deliberately. The fact that health and safety standards are affected by worker behavior can be a significant barrier to maintaining good standards in a workplace. You have explored the barriers to good standards of health and safety. It's time to take a safe shot. Drag the correct phrase and drop it in the blank to complete the statement. Well done! Choosing between the need to ensure profits and complying with the health and safety law places a barrier due to conflicting demands. You have explored good standards of health and safety. Next, let's understand general safety-related terms. Here's a list of the terms we'll be looking at. Health, safety, welfare, environmental protection, accident, incident, hazard, risk, death, disabling injury, frequency rate, severity rate, incidence rates. Let's explore health first. Health. The term occupational health, with reference to a work situation, indicates not only the absence of disease or infirmity, but also presence of physical and mental elements that may affect the health of employees and are directly related to safety and hygiene at work. Health hazards can be grouped into 4 principal categories: physical, chemical, biological, carcinogenic hazards. According to the World Health Organization, or WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You have been introduced to the principal health hazard categories. Now, let's examine health with relation to factors that contributes to one's illness. Anything that disrupts the physical, mental, and social well-being of a person can cause ill health to him. There are many factors that contribute to one's illness. The main causes of disease and ill health can be grouped as follows: infectious medical causes, non-infectious medical causes, social causes. There are other publications that define the term health as the protection of the bodies and minds of people from illness resulting from the materials, processes, or procedures used in the workplace. OHSAS 18001 standard defines occupational ill health as an identifiable adverse physical or mental condition arising from and or made worse by a work activity and or work-related situation. You have examined the connotation of the first health and safety term, health. Next, let's explore safety. We use the word safety so much, often in the company with its partner health, that it should be relatively easy to find a reasonable definition. Yet, the dictionaries do not offer much assistance. One dictionary says that safety is the absence of danger, and the same publication quotes danger as the absence of safety. Other word reference sources offer suggestions around a state of protection or a condition not involving risk. Perhaps the best we can think of is that there is no arbitrary state of absolute safety, as there is always a chance, a risk of something going wrong, despite how small that chance may be. In other words, we can say that safety is the control of unplanned events. Next, let's explore different safety hazards. You have been introduced to the concept of safety. Now, you will examine a range of hazards. A range of safety hazards can be found in any workplace. These include machinery, slips, trips and falls, fires. When you consider safety, you need to extend the coverage to ensure that occupational health is also included. Up until recent times, a lot of people did not think health damage was or is actually related to work. In real terms, occupational ill health is quite a significant element in workplace safety and is a direct cause of lost time from work. You have explored the connotation of safety. Now, let's explore welfare. Welfare is best understood as the provision of facilities to maintain the health and well-being of employees and others at the workplace. Welfare facilities provided by the industry or a company as part of employment can be called occupational welfare. Welfare includes perks, salary-related benefits, measures intended to improve the efficiency of the workforce, and some philanthropic measures. In the field of occupational health, safety, and welfare, the term workplace welfare extends to the provision, cleaning, and maintenance of a whole range of topic areas, but is not limited to the following: adequate space considering the task being performed, an ergonomically designed workstation, provisions to monitor and control the working employees in extreme weather conditions, lockers and changing rooms for keeping personal clothing and belongings in the workplace, meals and restrooms, provision of drinking water, washrooms and toilets. You have examined the connotation of welfare. Next, let's explore environmental protection specifically. Let's begin with environmental pollution. Environmental pollution is an issue that causes not only losses within the organization, but also losses through the bad public relations that unchecked pollution can cause. The effects of industrial pollution are not limited to the boundaries of an organization's premises, but spread far wider, affecting a large number of people. The overall impact of an organization's activities on the local and indeed global environment is becoming increasingly important for both from the image point of view, that is, being seen to be green, and also from the economic viewpoint. It is easier to determine that the high cost involved in pollution control is reasonable and justified when compared to the potential costs of not controlling it. In addition, mainly due to the wide-ranging effects, the public relations image of the organization could suffer, causing indirect losses to the organization as a whole. You have been introduced to environmental protection. The requirements of these acts normally encourage the organization that may be responsible for the pollution to be as rigorous as possible in their efforts to control pollution. Now, let's look at the main aspects of pollution control. Discharge to air. This includes smoke and vapor pollution from processes. Discharge to water. This includes ineffective control of liquid waste from processes. Discharge to land. This includes inadequate control of solid waste disposed on landfill sites. Local nuisance. This includes disturbance to the amenity of local residents resulting from work such as noise, perhaps from transport or the process, or excessive light from the site causing nuisance to local residents. You have explored the connotation of the following terms: health, safety, welfare, and environmental protection. It's time to take a safe shot. Select the correct option. Noise produced by the work activities is not an aspect of environmental pollution. Well done. The correct answer is false. Noise produced by the work activities is an aspect of environmental pollution. You have explored the connotation of the following terms: health, safety, welfare, and environmental protection. Now it's time to delve into the following: accident, incident, hazard, risk, death, disabling injury, frequency rate, severity rate, incidence rates. Here's a look at the connotation of accident, incident, hazard, and risk. Accident. Accident includes any undesired circumstances which give rise to ill health or injury, damage to property, plant, products, or the environment, production losses, or increased liabilities. Accident is defined as an unintended occurrence arising out of and in the course of employment of a person resulting in injury. Incident. As per the definition given in OHSAS 18001-2007. Incidents are work-related event or events in which an injury or ill health, regardless of severity or fatality, occurred or could have occurred. Note 1. An accident is an incident which has given rise to injury, ill health, or fatality. Note 2. An incident where no injury, ill health, or fatality occurs may also be referred to as a near miss, near hit, close call, or dangerous occurrence. Note 3. An emergency situation is a particular type of incident. Risk. It is a combination of the likelihood of an occurrence of a hazardous event or exposure or exposures and the severity of injury or ill health that can be caused by the event or exposure or exposures. Risk assessment. Risk assessment is a process of evaluating the risk or risks arising from a hazard or hazards, taking into account the adequacy of any existing controls and deciding whether or not the risk or risks is acceptable. Hazard. A hazard is a source, situation, or act with the potential for harm in terms of human injury or ill health, or a combination of these. Hazard identification. Hazard identification is a process of recognizing that a hazard exists and defining its characteristics. Here's a look at a few more terms. Death. This is fatality resulting from an accident. Disabling injury or lost time injury. This is an injury causing disablement extending beyond the day of the shift on which the accident occurred. Non-disabling injury. An injury which requires medical treatment only without causing any disablement, whether of temporary or permanent in nature. Reportable disabling injury or reportable lost time injury. An injury causing death or disablement to an extent as prescribed in the local law. For example, notice of any accident on the construction site which either A. causes loss of life or B. disables a building worker from working for a period of 48 hours or more immediately following the accident shall forthwith be sent to the board with which the building worker involved in the accident was registered as a beneficiary. Here's a look at a few more terms related to health and safety. First, let's look at the frequency rate. Frequency rate. The frequency rate may be calculated either for lost time injury or for reportable lost time injury as follows. Frequency rate FA equals to number of lost time injury multiplied by 10 lakhs divided by man hours worked. Frequency rate FB equals to number of reportable lost time injury multiplied by 10 lakhs divided by man hours worked. Note 1. If the injury does not cause loss of time in the period in which it occurs, but in a subsequent period, the injury should be included in the frequency rate of the period in which the loss of time begins. Note 2. If an injury causes intermittent loss of time, it should be included in the frequency rate once, that is, when the first loss of time occurs. Note 3. Since the frequency rate FB is used for lost time injuries reportable to the statutory authorities, it may be used for official purposes only. In all other cases, FA shall be used for the purpose of comparison. You have explored frequency rate. Now, let's examine severity rate. Severity rate. The severity rate shall be calculated from man-days lost, both from lost time injury and reportable lost time injury as indicated below. Severity rate SA equals to man-days lost due to lost time injury multiplied by 10 lakhs divided by man-hours worked. Severity rate SB equals to man-days lost due to reportable lost time injury multiplied by 10 lakhs divided by man-hours worked. You will examine the details of these equations shortly. Let us now discuss the severity rate equations in detail. Note 1. Since the severity rate, or SB, is used for lost time injuries reportable to the statutory authorities, it may be used for official purposes only. In all other cases, SA shall be used for the purpose of comparison. Note 2. Calculation of man-days lost shall be guided as below. Actual man-days lost due to temporary total disability. Man-days lost according to the schedule of charges for death and permanent disabilities as given in Appendix A of IS 3786. In case of multiple injuries, the sum of scheduled charges shall not be taken to exceed 6,000 man-days. Days lost due to injuries in the previous periods, that is, if any accident occurred in the previous period is still causing loss of time in the period under review, such loss of time is also to be included in the period under review. In the case of intermittent loss of time, each period shall be included in the severity rate for the period in which the time is lost. If the injury is treated as a lost time injury in one period and subsequently turns out to be a permanent disability, the man-days charged to the injury shall be subtracted from the schedule charge for the injury when the permanent disability becomes known. You have explored frequency and severity rates. Here's a look at incidence rate. Incidence rate is the ratio of the number of injuries to the number of persons during the period under review. It is expressed as the number of injuries per 1,000 persons employed. The incidence rate may be calculated both for lost time injury and for reportable lost time injury as follows. Lost time injury incidence rate equals to number of lost time injuries multiplied by 1,000 divided by average number of persons employed. Reportable lost time injury incidence rate equals to number of reportable lost time injuries multiplied by 1,000 divided by average number of persons employed. You have explored terms related to health and safety. It's time to take a safe shot. Select the correct option. Which of the following statements define the word risk? Well done. Risk is a combination of the likelihood of harm occurring and the severity of the harm. You have explored the meaning and definition of various terms related to health and safety. Now, you will explore the reasons for implementing good standards of health and safety. Working life in the world as a whole is changing at an ever-increasing speed, which can give rise to new risk areas or change the way that occupational safety and health needs to be managed. There are a number of moral, social, economic, and ethical arguments for maintaining good standards of health and safety, and these can be further categorized into internal and external pressures. You'll explore these pressures shortly. Here's a look at the pressures an organization faces. Internal pressures. Here are the internal pressures that pose a challenge to any organization. Health and safety versus other business priorities and objectives. Safe behaviors versus corner cutting for speed or cost reduction. The organization culture versus peer group pressure. Competing business units with individual cost center budgets which fail to cooperate. External pressures. Here are the external pressures that pose a challenge to any organization. The expectations of clients or customers. Expectations of society. Legislative requirements including changes. Client demands for faster project completion. The level of safety implementation and the HSE cultures will vary significantly depending on the level of internal and external pressures existing within an organization, the industry, and the country as a whole. You have explored internal and external pressures that organizations need to step up to. Now, let's examine monetary advantages of effective health and safety management practices. It is essential that the reasons or arguments for managing health and safety are clear, concise, and well understood throughout the organization. There are a host of sensible business reasons for the effective management of health and safety within a business. Monetary advantages include reduced loss of time and associated costs through injury and/or ill health, reduced loss due to damage, reduced levels of absenteeism and its knock-on costs, reduced insurance costs or premiums, increased or improved company reputation in the marketplace, leading to more orders being secured or purchases. Reduced costs associated with litigation, that is fines, compensations, legal defense costs. Improved quality and output due to improvement of employee morale. You have been introduced to the monetary advantages of effective health and safety practices. Here are the main arguments in favor of effectively managing health and safety within an organization. Legal and compliance reasons to avoid prosecution and/or compensation claims. Financial issues, including the costs of accidents and ill health. Moral and humanitarian reasons. Social reasons for expecting a good standard of health and safety. You'll explore each of these arguments individually in the next few screens. Here's a look at levels of statutory duties which form a part of the legal reasons that necessitate effective health and safety practices. The 3 levels of duty are absolute duty. This is the highest level of duty and often occurs when the risk of injury is so high that injury is inevitable unless safety precautions are taken. Throughout the world, many health and safety management requirements are contained in the health and safety law that place an absolute duty on an employer. The need for having a written statement of policy in respect of safety and health of building workers and submit the same for the approval of the Chief Inspector of Inspection of Building and Construction is mandatory when more than 50 building workers are employed in an establishment as per BOCW Act 1996. This is an example of absolute duty. Practicable duty. This level of duty is more often used than that of absolute duty with regards to the provision of safeguards and in many ways has a very similar effect. A duty that the employer ensures, so far as is practicable, that any control measure is maintained in an efficient state means that if the duty is technically possible or feasible, then it must be done irrespective of cost, inconvenience, or difficulty. Reasonably practicable duty 2. However, please be advised that money, time, and trouble must grossly outweigh and not balance the risk. The statement should not be interpreted to a conclusion that if time, cost, and effort permits, you take the safety precaution and otherwise you need not. After taking all the basic precautions, in order to know whether we have taken all the reasonably practical measures or not, we can use the clarification given in the judgment of the referred case law. In addition to the given 3 levels of duties placed on the employers through the health and safety law, the organization may also want to consider the fact that the enforcement authorities may prefer fines, prohibition notices, and ultimately prosecution in the court on the employers if they are found to be violating any of the provisions in the applicable health and safety law. Reasonably practicable duty 1. This is the most common level of duty that will be seen in the health and safety legislation of most of the countries. For example, the BOCW rules say that all reasonably practical measures shall be taken to avoid injury to building workers while structural steel or prefabricated parts are handled or stowed or transported or raised or lowered. In order to understand whether all the reasonably practical measures have been taken, organizations can take help from one of the case laws in UK way back in 1949. Edwards versus the National Coal Board. To quote from the judgment of the given case, if the risk of injury is very small compared to the cost, time, and effort required to reduce it, then no action is necessary. You have explored the levels of statutory duties. It's time to take a safe shot. Drag the correct phrase and drop it in the blank to complete the statement. Well done. A reasonably practicable level of duty will be commonly seen in the health and safety legislation of most of the countries. You have been introduced to the legal reasons for establishing and maintaining good standards of health and safety performance in organizations. Now, let's move on to the next important consideration for managing health and safety: financial reasons. Within an organization, many of the business decisions are based on financial issues. This is also applicable to management of health and safety function within an organization. Health and safety is one aspect of the business that can result in significant financial and business loss to an organization if not handled correctly. However, it is often not accorded sufficient attention at senior management level. As an indication, consider the director or senior manager that the health and safety advisor reports to. It's not always the managing director or chief executive who is important. Here, let's continue with the financial reasons. The cost of poorly managed safety can be a significant drain on the financial and other resources of an organization. This can be mitigated by the effective use of experts to render health and safety advice and assistance. The financial justification for the health and safety function is given by the cost-benefit arising from the advice provided by the expert against the costs to the business of obtaining that advice. One of the main problems is that accidents always cost more than the initial estimate. In any accident, there are costs incurred because of the direct aspects of the accident, such as time off work, repairing damage, and similar charges. However, there are also indirect costs. You will explore direct and indirect costs shortly. You have explored the reasons behind supporting effective health and safety practices in organizations. Now, here's a look at direct costs with regard to financial reasons. Increased insurance costs, absence and replacement costs, treatment costs, transport costs, ill health costs, property damage, business interruption cost, product-related losses. Let's explore indirect costs now. Indirect costs may not be immediately or directly associated with the accident and frequently are not considered as they either do not appear on the financial records or are hidden or subsumed under other financial headings. Some of these tend to impact society as a whole and will not normally be noticed by individual employers. Such costs include those to the Health Services Authority for treatment of injuries, those associated with the time and resources of investigators, including the local health and safety enforcement body, government ministries, and the police. Some of these may be recoverable directly from the employer if a prosecution is brought, but this is not so in all countries. Retraining or re-employment of workers, either to address gaps identified by the accident or as a result of the loss of skilled workers through injury. Loss of morale in the workforce leading to poor production, service, or other achievement of operating targets. Loss of public image with an impact of consumer, supplier, or user attitude towards the company. Dealing with media, such as the press and other interested parties, including trade unions, industry bodies, and special interest groups. Loss of reputation, commercial liability. You have explored various types of indirect costs. Now, let's look at some figures with regard to such hidden costs. Various projects have been undertaken by government and non-government bodies, and estimates indicate that the hidden cost of an accident can range between 5 times to 55 times the actual known costs of an accident. The table you see on the screen discusses the additional revenue that has to be generated to recover the accident costs. For example, to recover an accident cost of $200,000, assuming a profit of 5%, the organization has to do an additional business of $4 million. You have explored financial and legal reasons that favor use of effective safety and health practices. Now, let's look at some moral reasons. A failure in health and safety within an organization will result in pain, injury, or loss to the injured employee. It would be rare for an organization to take a corporate view that this pain and suffering is a necessary part of their business. Needless to mention, this attitude should be avoided. The benefits of good health and safety business practices are far more ranging than just having a safe place of work. Following are some of the main moral benefits of establishing and maintaining good standards of health and safety in the workplace. Better working relationships between management, workers, and clients. Less time away from work due to stress, sickness, and duvet days. Improved willingness to learn and develop new and existing skills and work knowledge. A peaceful work culture. Having a safe and pleasant workplace will ensure employees enjoy working for the company and a happy workforce will produce many benefits. Visiting clients will feel comfortable and more prepared to do business, which by itself is a big benefit. You have explored reasons for managing health and safety. It's time to take a safe shot. Select the correct option. Effective management of safety will bring in reduction in the insurance premium. Well done. The correct answer is true. Effective management of safety will bring in reduction in the insurance premium. Here are the key concepts that have been covered. Safety. Complexity, conflicting demands, and behavioral issues are different types of barriers to achieving good standards of health and safety in the workplace. Meanings and definitions. Health, safety, welfare, environmental protection, accident, incident, hazard, risk, death, disabling injury, frequency rate, severity rate, and incidence rates, all these terms comes under health and safety area. Reasons for managing health and safety. Depending on the level of internal and external pressures existing within an organization, the industry and the country as a whole, the level of safety implementation and the HSE cultures will vary significantly. This will drive the need for managing safety within the organizations. Financial or economic. An accident always caused directly and indirectly. Having a safe and pleasant workplace will make the employees enjoy being or working for the company, and a happy workforce will produce many benefits.